Self-compassion is great, but not in the way that you might think. It seems to vibe with what many think are the solutions to the personal challenges they're dealing with. People on social media have much to say about it, and maybe you think it's for you. Then you work on practicing being kind to yourself, and disaster strikes. Your inner critic doesn't get weaker. Instead, it gets stronger and louder. And you might think to yourself, my name is Leo, licensed mental health counselor. Let's break this down. Self-compassion comes from the self-compassion model created by Kristin Neff, which has informed therapeutic approaches to trauma work, such as compassion-based therapy. And the model can be broken down to 3 major components. The first one is mindfulness, which looks like the ability to observe your thoughts and emotions with no judgment whatsoever. Practicing mindfulness here can expand your window of tolerance to make more room for more helpful perspectives, such as common humanity, which is the perspective that says failure, pain, and imperfection aren't isolated events, but instead a shared experience. We're human, not broken. And when we remember that we're in this together, we start building compassion for ourselves and others too. Which then brings us to self-kindness, which is fairly straightforward. The obstacle here is when we're led to believe in the dominant culture that toughness equals strength. However, the research says that when we practice self-kindness, we increase our motivation, accountability, and long-term resilience. So, pick your poison. Putting this all together is all hunky-dory until being kind to yourself goes wrong. What's the deal? Because the evidence is there. A recent review of 50 studies with adolescents and young adults aged 14 to 24 found that higher self-compassion was strongly linked to lower anxiety and depression. Intervention studies consistently show moderate to large reductions in symptoms after self-compassion training. And a 2012 meta-analysis showed that compassion-based interventions significantly decreased stress, anxiety, and depression. So what are we missing? Well, here's what I think. Out of the 3 components of the model, we're quick to gravitate to delve right into self-kindness, like bees to a hive. But if we get into it without having a foundation for mindfulness first, that's when the wasp shows up. We risk enmeshment between the thoughts we're trying to construct by ourselves and the inner critic that devours our efforts. And until a person can diffuse from their inner critic, their self-kindness will continue to be matched by self-loathing. Once we understand this, then we've got a fighting chance. Comment below how you show self-compassion with yourself every day. Like and subscribe for more mental health content. And if you happen to be one of those individuals who seem to be failing at this, you're not failing, you're falling forward. Now take this with you and go practice some of that mindfulness in therapy.